All right, away from that, the Gauteng Health Department has recorded an increase in teenage pregnancy and the termination of pregnancies among girls aged between 10 to 19 years. According to the department statistics, more than 20,000 deliveries and terminations of pregnancy have been recorded in public hospitals across the provinces and increased compared to previous years. In its bid to fight this pressing issue, the department says it will release an intervention plan. And to discuss this, we're joined by Director, Child Protection, National Department of Social Development, Ms. Neliswa Cekiso. She joins us from Johannesburg. Hello, Melissa. Thank you so much for joining us.
Good afternoon, and thank you so much for inviting the Department of Social Development. Greetings to the viewers as well.
Good afternoon. All right, now there seems to be an alarming surge of teenage pregnancy and also termination of pregnancy in Gauteng. Not only that, but also South Africa as a whole. In your view, why is that, and what could be a contributing factor to this?
From the research point of view, because what we have done as the country, we did research on the factors associated with the teenage pregnancy, and then we are also currently busy with the diagnostic review, evaluating government's response in addressing teenage pregnancy. What we are picking up is the issues of partner and peer-related, pressures, which contributes on these matters. The issues of education, which we are rendering as the country. However, we believe that it's not yet enough, reaching these ages of 10 to 14, as well as 14 to 18. And the other issues that we are picking up is the structural, factors, where issues of inequality, gender-based violence, it's also linked into these issues of teenage pregnancy, because when you look at it, the issues of power relations, where the young girls would get engaged with the older men because it's more of transactional sex due to the triple challenges that are confronting the country, which is your unemployment, inequality, and poverty. So the young girls now find themselves getting involved with these older men whom they don't have really the power to negotiate, safer sex.
All right, now looking at these factors that you have listed, could it be that, young people in South Africa don't get enough education around sex?
We would say yes. Previously, that was the case. But now we are intensifying implementation of what we call comprehensive sexual education, which is driven by the Department of Education, because that's where our young children are. So as part of the curriculum, that sexuality education, it's really helping to shape, the way they think. And we also have programs that we call social and behavioral change program that are intended to enable the young girls to actually make informed decision. But we're not leaving out the young men, so that the young man doesn't put unnecessary pressure on this young girl to engage in sexual activities.
All right, quite a disturbing issue, but thank you so much for joining us and speaking on this. And we hope to have you some other time to discuss more on this as well.
Thank you so much. And for South Africa, May month is Child Protection Month, and we really want to address the issues of teenage pregnancy. Thank you.
Definitely. Thank you.